name is Mark Roithmeyer, and I have the privilege of serving as the CEO of the Alzheimer's Drug Discovery Foundation. It is an honor to be here today, especially to commemorate the 10-year anniversary of this inspiring event, Hope on the Horizon Fall Symposium in Luncheon. Woo! First, we need to do a big shout out and thank you to our good friends from Lilly for sponsoring this morning's terrific educational forum, Repurposing Drugs for Alzheimer's Disease. Our friends from Lilly, we so appreciate your support. Let's give them a round of applause. We also want to give a big thanks to our leadership in our committee for today's event. A big thank you to Luncheon event co-chairs, ADDF board members Sharon Sager and David Weinreb, and as you will see is this very full screen, a terrific host committee. Can we have a round of applause for them? And any of you who have been here the last couple of years, I am most proud to tell you about their outstanding work because, as you can see, it's a little tight in this room today. Over 400 guests, and as of you walking in, we've raised $1,110,000, marking the third year in a row we've beat $1 million. There's probably one person we can most thank for this incredible success. You are going to hear a lot about her after lunch. You are going to meet her after lunch. But how about our honoree, Ms. Pamela Newman? Yeah, there we go. There's also one other person I just need to mention, because if you know Pamela, you know there is a throne behind her power that's worked tirelessly on this event. Shari Rudman, we love you. Now, a couple of fun facts about the event. 10 years we've been doing this. We have multiple past honorees in the audience with us, and I'd like them to stand as I call their names. Chris Johnson, honoree 2012. Liz and Randall Sandler, honorees 2013. Randall's the vice chair of our board. The incomparable Mr. Donald Newhouse, 2016. And the one and only, the honoree that first brought us over $1 million, 2017, Ms. Sharon Sager, the chair of our Board of Overseers. One other fun fact, just a show of hands. How many people were here 10 years ago for the first one? First of all, we want to thank you for being here 10 years ago. And if you will remember, we actually did not have honorees the first year. What we had were two incredible people that made remarks. One is who's with us today, such a dear friend of the organization, columnist, author, advocate, passionate philanthropist, Ms. Joan Sutton Strauss. Joan? And then the other, anybody who was here the first year couldn't forget the second round of remarks there, and Nancy Goods, it's our beloved Mel Goods 10 years ago, right? One last thing I want to do, on behalf of my business partner, the fabulous Dr. Howard Fillett, and myself and all of the staff here. They say when you work for nonprofits, if you're staff or you're on a board, a nonprofit is only as strong as its board or boards. And at the Alzheimer's Drug Discovery Foundation, we are blessed to have two boards, the Board of Overseers, which is chaired by Sharon Sager, and the Board of Governors, which is chaired and co-founded and co-chaired by, obviously, Leonard and Ronald Lauder. You're only as strong as your boards. I would like both boards to stand up for a round of applause. Could you just stand and see how many of them are with us today? All right. There's a bit of a commercial I need to do here right now. $1,110,000. It would appear we are on our way to at least our second best year ever. And the only thing standing between us and new records are the door prizes. So in your journals, you will see wonderful door prizes that we have, some fabulous weekends in Palm Beach, gift baskets from Estee Lauder, just fabulous. Yeah. So, and you also have this simple card, and what we ask is that you'll see staff coming around during the event, and just fill this out. Any donation counts, and then we're going to pull for door prizes before the day's over. We ask you, so many people here are so generous, if anything you heard this morning or anything you get motivated by this afternoon, if you can think a little bit more and give a little bit more, we would so appreciate it. Records are within our sight, okay? So, just a wonderful reminder, and thanks to the Lauder family. Every nickel that you give goes directly to the science because the Lauder family covers all the expenses of the organization, okay? So great, yeah, round of applause there. All right, stay with me, folks, because now we're going to officially get started. We are a strong but mighty organization. 10 years we've been doing this luncheon. So to commemorate the 10th year, we have a special presentation. We're going to mix up the agenda a little bit from years past. Our special guests, ADDF's founding executive director and chief science officer, Dr. Howard Fillett, and our wonderful board members, Bonnie Pfeiffer Evans and Alice Shore of the Charles Evan Foundation. The creators of the award we give out today, the Charles Evan Award, will exchange their thoughts about the importance of research, what it means for today and the years ahead, and why we continue to hope. Moderating this exciting panel is somebody that if you've been to any of our lunches or a connoisseur's dinner, you know her so well. She's been our host for many years, the 9-time Emmy Award-winning journalist, ADDF board member, dear friend, Paula Zahn. Yeah. Paula is also the executive producer and host of Discovery ID's weekly crime show, On the Case with Paula Zahn, host of public television, WNET's NYC Arts, Thursday night must-see TV, as well as an accomplished cellist who has performed at Carnegie Hall. Ladies and gentlemen, I give you Ms. Paula Zahn.
Thank you, Mark, for that very generous introduction, and congratulations on that amazing number you just announced, plus $1 million. Bravo to all of you in this room. Thank you for your generosity. I'm very honored to be with all of you today as the host of the 10th annual Hope on the Horizon Luncheon. In fact, like many of you in this room, I'm 10 for 10. A raise of hands for those of you who've made all 10 of 10 lunches. I know you're out there. Don't be shy. On behalf of the Alzheimer's Drug Discovery Foundation and its co-chairman and co-founders, Leonard and Ronald Lauder, I welcome you all here today. Leonard Lauder was very much looking forward to joining us today. However, as some of you might know, he is recovering from back surgery, and I hear he is doing very well. In fact, I saw him last weekend, and he looked great, and that made me very happy. Let's all give him a loud round of applause so he can hear us up the block. We host this luncheon every year to honor an exceptional leader of Alzheimer's research with the Charles Evans Award. And a little bit later on, we look forward to presenting the award to an outstanding advocate, supporter, Pamela J. Newman. Yay, Pam. But first, I'd like to welcome our special panel up to the stage, ADDF founding and executive director and chief science officer, Dr. Howard Fillett, along with, as Mark just mentioned, ADDF board members and creators of the Charles Evans Awards, Alice Shore and Bonnie Pfeiffer Evans. Each have a very special connection to the ADDF and will share with us why your support is so important. Thank you. Welcome all. Thank you. First of all, our heartfelt condolences to your family. I know this is a very tough time as you're dealing with your loss, and we are so honored that you adjust a lot of things in your life to be here today at this very sad time. So thank you very, very much. I'd like to talk to you about something that I think will put a smile on people's faces, and that is the Charles Evans Award. And I would love to hear what inspired you and your family to come up with this idea.
Well, Charles and Alice and their brother's father had Alzheimer's. He suffered from it and he died from Alzheimer's. Our Charles hoped to find a cure in his lifetime, and he didn't. But he dedicated his passion, his energy, his life, his money to Alzheimer's research. He made large donations, he got involved, he was passionate. He was even one of the founding members and, in fact, the national director of the Alzheimer's Association in the beginning days. So after Charles passed away, here's the happy part, sorry. Alice and I really wanted to carry on Charles's passion and his spirit and his legacy of giving with the Charles Evans Award, and also to validate his desire to really make a difference through philanthropy.
Each year with this Charles Evans Award, we want to honor a leader who's made a significant contribution to Alzheimer's research, like Charles did. I so wish I could tell him about all the progress that's being made today, and especially that Bill Gates, as well as Mackenzie Bezos and Jeff, have joined the fight to conquer this disease.
And do you want to talk a little bit about this year's honoree and what you think the awarding of this should mean to all of us?
The reason for this award is to celebrate the power of philanthropy. And this year's awardee, like all our past awardees, is really focused and dedicated and hardworking and giving, and has, for instance, Pamela today, look at the number we have today because of Pamela and all of you. So here we all are. Here we all are, and we're working together, and that's what the Charles Evans Award is about. It's about saluting someone who is working really hard and bringing us all together. And we really thank all of our awardees for all that they do and continue to do, and we will continue to do.
So, as Bonnie said, the award is about carrying on Charles's hope to find a cure for Alzheimer's. And all the people we have honored with the award really go the extra 9 yards in their support of ADD and its research. It's so thrilling to be here on the 10th anniversary of this major, major effort. This year's awardee is fantastic. We are thrilled to present her later in the program. Pamela Newman is our star this year. Meanwhile, please join us in celebrating the fact that hope is definitely on the horizon. Thank you.
Thank you. Talk about going the extra 9 yards. Your simply being here today says it all about your joint commitment to ADDF and this award, which has basically been handed out, I think, 9 out of 9 years?
Yeah.
Which is really quite remarkable. Thank you very much for your generosity. Howard, you've been with ADDF since it was founded 21 years ago. You would have to acknowledge during that period of time, there have been a lot of disappointments, not just for our organization, but anyone who, like you, is passionately trying to find a cure for Alzheimer's or trying to find a drug that will help stave off some of the symptoms of the disease. And I'd like for you to explain to all of us here how deft you've had to be in reacting to so many things you can't control as you continue with a razor-like focus to focus on that cure.
Yeah, thanks, Paul. And I want to thank Alice and Bonnie for your partnership over all these years. We're very grateful to you. You know, science is incremental, and it's been said that it takes roughly 35 years from the time a discovery is made until a drug is actually developed. And actually, a very hard part, the hardest part of science is not necessarily in the basic biology or in the basic research, but actually in the chemistry and the regulatory science and all the things, the clinical trials that are so hard in our field to develop a drug. Imagine we're trying to develop a little white pill that one day all of us can take that will prevent and treat Alzheimer's. That will be amazing. And you know, I've been doing this 40 years. And when I started, there was literally nothing known about Alzheimer's disease. People hadn't even heard the word when I told people that I was going into research and care of patients with Alzheimer's disease. So we've just made, you know, real briefly, amazing progress in my mind. I mean, today we have diagnostic tests. If in my practice I can send somebody down to the radiology office and they can get a test, and within a few hours I can tell them whether or not they have Alzheimer's disease. In the old days, the only way we could do that was with a brain biopsy or an autopsy, and a lot of people didn't want to go through an autopsy.
Yeah. I think you speak for everyone in the room here today. Thank you, Howard.
But today, and the thing that I think has been most amazing over the 20 years is the model that was set up by Ronald and Leonard. I just look back at that document that we submitted to the Internal Revenue Service on the day that we incorporated, and it was like the Constitution of the United States. It was just this brilliant document, and we told them that we were going to, because we were the only thing that we were going to do. We weren't going to do advocacy or education or counseling or anything, not basic research, just drug discovery and development. That still today is very unique among foundations. There's no other foundation in our field that does that. And then we told them that we were basically going to take this venture philanthropy model, which wasn't being done. We told them day one we were going to invest in biotechs. And since then, we've made over 130 investments. And each of these are small investments to catalyze and seed early stage programs that are very high risk, that investors like venture capitalists and private equity people and the public markets won't fund, because our job as a philanthropy is to take risk. And the job of venture capitalists is to follow on, big pharma to follow on. But
and put that into perspective.
Yeah.
What is the failure rate of the average drug tested in the market? It's 98%.
Well,
it's stunning.
Some sound bites. Judy Wendt was the CFO of Merck for many years, and I read her quote one time. She said that 90% of the people who work in the pharmaceutical industry will spend their entire careers never working on a drug that comes to market.
Wow.
Now, in our field, so these are people that love science. They love develop, the process of, and yes, we would all love to have the drug, but we're learning from every clinical trial we do, every experiment that we do, and this is particularly true. It's so exciting now because now we have positive results. We talked about them this morning. We're starting to get positive results.
So for the folks in this room that missed the symposium this morning, where do you think the greatest hope lies?
Well, one thing I want to say is that we're envisioning a day. This is a disease of aging, and so we're going to have to attack it in multiple pathways, just like we do in cancer, which is a disease of aging. Most cancer patients are on 4 or 5 drugs. Diabetes, hypertension, these are all diseases of aging where you have to, there's not one cause, you have to attack it, and people are going to have to be on combination therapy with what we call precision medicine. So if you have a cancer, they type your cell. Those are biomarkers, and that's why, as you mentioned, we're working with Bill Gates and the Bezos family and the Schwab family and the Dolby family and some others to develop a blood test for Alzheimer's disease. And we're going to have a blood test for Alzheimer's disease. We're going to have a blood test for Alzheimer's disease in about 3 years on the market. You'll be able to go into your doctor's office And you don't have to go through an expensive brain scan. You're going to get a blood test. And there's going to be a lot of blood tests for Alzheimer's.
Yeah, but what does it tell you?
The first test that'll come to market is going to be an amyloid test. So we can look at amyloid in the blood. We have very highly sensitive technology now to look at amyloid in the blood. Just as last week, a paper came out showing that one of the blood tests that's in development now is more sensitive than the brain scan and predicts people who are going to get brain scan positive. So we can detect the Alzheimer's disease now in 40-year-olds and 50-year-olds 20, 30 years before they even start to have symptoms. And that's changed the world because that enables prevention. Right? So we can start treating people before they even have symptoms. So,
but is there anything on the market today that you could take advantage of that would treat those symptoms early on?
Any drugs on the market?
Because that sounds like great news, but you say, okay, this is going to develop when I'm 55. How can you help me?
So we know that inflammation plays, this is something that I've been at for 35 years in my research, but it's finally come of age that inflammation in the brain is actually what triggers cognitive decline. People can have amyloid in their brain, but if they don't have an inflammatory response, it's looking more and more like they're not going to progress and develop symptoms. So the largest part of our drug discovery and clinical development program are anti-neuroinflammatory drugs that specifically attack the inflammation that's going on in the brain. We're in phase 2 clinical trials now in Europe with a company called Neurokine, a small biotech that was spun out of Northwestern. We've been doing repurposing clinical trials of drugs like Enbrel and others. We're also looking at repurposing diabetes drugs. As we talked about this morning, we have the largest portfolio of repurposed drugs that I know of. We have 16 repurposing drugs. We're repurposing liraglutide, a leading drug for diabetes, because glucose is so critically important and insulin resistance in the brain. Just imagine if you're diabetic and your glucose drops below 60. What's the first thing that happens to you? You go immediately unconscious. That's how sensitive our brain is to needing glucose. Imagine all those cells that are not getting enough glucose because they have insulin resistance or diabetes. And that's a really big factor. We're also looking at antihypertensives. So, I mean, I'm just so excited.
It is an exciting time. Come back to the second prong of the test. So this blood test, you said will be available in 3 years. It tests your amyloid levels. What are the other markers that test for?
We're also looking at blood tests that look at inflammation, that look at genetic risk. We're looking at blood tests that can detect tau in the blood. So we talked about tau imaging this morning, how that correlates with cognition and is the tangles. It's representing the tangles. I never thought we'd ever be able to get a blood test for tau, but it's looking like we're going to have a blood test for tau. And then beyond that, we're going to, just like precision medicine for cancer, we're going to subtype people who has inflammation, who has epigenetic disorders, and then those will become drug targets. And what we'll do is, and what we're doing is then we enrich the trials for the people that have the specific pathologies in their blood or in their spinal fluid, like inflammation. So we'll be able to target and enrich and do much better clinical trials. If we're testing anti-inflammatories, then we want to find the people with Alzheimer's who have inflammation. And that's where the biomarkers play a critical role in enrolling patients into trials and then using those biomarkers as measures of whether the drug is working. And we haven't been able to do that up to now. So that's why it's such an exciting time, because now we can finally do really rigorous clinical trials. We've been doing clinical trials in cancer for 80 years, so it's really paid off. We're going to get there a lot quicker.
Yeah, the arsenal of repurposed drugs you've created, ADDF, really is impressive. So I was wondering if you could educate all of us about the role that the folks in this room and sitting on the stage play in helping you continue to hone in on your goal. I mean, the government is not giving you much help, is it?
Well, the government...
No one in the government is here today listening to you, Howard.
You know, the government has an important role, and the NIA, the National Institute on Aging, has evolved, and they really are playing a better and better role. But the difference between the government and philanthropy is that we're much more nimble. We can take risk. We can get things turned around in 6 months or 8 months. The government can take 18 months to get somebody approved. Where the government comes in is they have much more money than we do, but we're in the business of taking risk on new projects. A lot of the projects that the government, that the National National Institute on Aging ends up funding are projects that we originally took risk on. You know, we might give an investigator $500,000 or $3 million to do a project, and they get a proof of concept. They ask a question, they get results, and then they apply to the NIH, because the NIH says, well, where's the data? Well, we give them the data, we give them the money. And this is also true for the biotechs. The biotechs, the early stage biotechs with novel technology, have a terrible time raising money. And we've made a lot of investments in biotechs that then come back and they get venture capital money, or they do a license with pharma. So philanthropy really plays a critical role. The other thing is that I've always, one of my mentors was the physician scientist who proved that DNA is the material of life back in the 1940s. And he told me, he said, never give up your private practice, because it always keeps your feet on your ground and reminds you of why you're doing what you're doing. And I've always had a very small, in fact, my original contract with Ronald and Leonard stated that I must maintain a small private practice. And I think where I get inspiration is from all of you in all the things that I know you're suffering. My dad died of Alzheimer's at 87. I saw what he went through. I've taken care of thousands of people over the last 40 years. But I think all of us we have 9 scientists on staff, and we all get our inspiration from people like you.
Well, I too get my inspiration from people like you and you, but you as well. And I have to say, as an aside, my family was very blessed to have Howard consult on my mother's case, and your sense of compassion was extraordinary. So we all owe you a debt of gratitude on so many fronts. Just food for thought, like 40-second thought as we dive into our lunch here. This is like asking you who your favorite child is. This is hard to quantify. What is your biggest dream that you actually think could be realized in the next 10 years if we can continue to fund these initiatives the way we have been?
I can give you a very specific answer. So there's an entity called mild cognitive impairment, which is a phase, it's like what we call a prodromal phase of Alzheimer's. It's like the first time that symptoms really start appearing. People come in and they have memory problems, they complain of memory problems, and we can sort of document it, but they don't have a lot of the other problems of dementia. They don't have dementia, they don't have language difficulty, and they basically don't have any functional problems. They can feed themselves, they can plan a trip sometimes or do things. So they have quality of life, but it's the earliest stage where there's the emergence of symptoms, and then we can do the brain scans or the blood tests, and we can say we know they have the disease. And I think it's half of our trials right now are targeted, half of about 30 clinical trials that we're currently supporting, which is a lot. About half of those are in people with MCI, about 55%. And the idea is prevention. It's preventing people with MCI that have very minimal symptoms and good quality of life from becoming demented. And I think that's a very achievable goal in the next 5 years.
Yeah. Well, thank you. Thank you very, very much for helping lead off our luncheon here today. And again, we're so deeply appreciative that you all are here today. Enjoy your lunch, and we'll be back with the rest of the program right after that.
Thank you.
I hope you all enjoyed your lunch. And I also hoped you enjoyed our discussion with Alice and Bonnie and Dr. Howard Fillett. Right now, I would like to share with you the heart and soul of the ADDF as told through the stories of scientists and families affected by Alzheimer's, like so many of you out there whose lives have been deeply impacted by the heartbreak of Alzheimer's. My 95-year-old mother, who is still alive with us today, was diagnosed more than 7 years ago. My mother, Betty, was always fiercely independent. She was a college professor. She spoke 6 languages fluently and was truly engaged in life. She was a bright light. Today, she doesn't recognize any of us. She has 4 children who she loves and adores and hasn't recognized us since her diagnosis. She's confined to a wheelchair. and she can't speak anymore. And it is beyond heartbreaking to see my once vibrant mom, who was filled with insatiable curiosity, silenced by this horrible, horrible disease. Alzheimer's has stolen her soul. And I think that Sharon Sager poignantly said 2 years ago when she was honored by ADDF, that's what Alzheimer's does. It doesn't just affect the patient, it hurts entire families. It forces us to watch the people we love fade away, memory by memory. And Joan Sutton Strauss, who is with us today as well, has called it a disease of the brain that is paid for with the currency of the heart. And she has allowed me now to share a very short story with you all, about her husband of 35 years, who sadly lost his life to Alzheimer's. And her last memory of him, and this was such a beautiful gift to you, was his looking up to her at the end of his life, and he said, "Are we in a safe harbor?" And she said, "Yes, we are." Wow, what a final gift. So I want to share with you now a film that speaks to the exciting and encouraging impact and progress of ADDF, our unique approach to drug discovery and diversity of approaches, and this unique minds behind it, the drive and the hopes for the near and the long term. I was thrilled to be a part of it along with other board members who you will recognize in the film, and it is now my pleasure to share with you ADDF's story. And in recognition of Alzheimer's Awareness Month, the ADDF will be launching this video through its communication channels to educate people about important research developments and encourage them to keep it going. Please watch. The kind of disease that can break a family apart, or in a very beautiful way, bring everyone together.
The Alzheimer's Drug Discovery Foundation is the only nonprofit solely dedicated to the discovery and development of new drugs for Alzheimer's disease and related dementias. Investors shy away from early stage drug discovery because of risk, but that's where philanthropy really can play a very important role. Our model is unique because Tom and Leonard Water underwrite all of the overhead of the foundation. Any donation, 100% goes to the development of new drugs.
The pathology of Alzheimer's disease is really identified by the vast majority of late-stage clinical trials, 45 pharma industry has been focused on it.
But it's not proven to be druggable, and it may not be a good target for Alzheimer's. If you consider that aging is the leading risk factor, now's the time to translate that knowledge into the development of new drugs. And that's our scientific strategy. ADDF recognized early on that this is complex disease, and it needed to be approached from multiple angles to figure out what to do. We were really the first one.
What's always interested me in the ADDF's venture philanthropy is that the organization can be a risk taker, able to back great science or a great idea, and have the time frame to nurture that to a growth of science innovation.
Today, you have Bill Gates and other generous philanthropists saying that this is the pathway to finding a cure.
There are so many drug programs today that we started that have gone on to progress through the drug pipeline. Michaela Gallagher has one of the very few drugs in phase 3 today for Alzheimer's disease, and one of the only drugs that's not an amyloid program.
Alzheimer's disease is driven by neural overactivity, and we have a drug that decreases that overactivity.
If the drug works, it might delay or prevent the progression to dementia for people who come through.
One thing
one of the real advantages of working with the ADDF is the speed in which they can move with after risk development. 60% of the time, dementia experts in the United States get the diagnosis of Alzheimer's disease wrong. The first diagnostic test approved by the FDA for Alzheimer's is the analytic scan. Well, it's a test that we funded. The scan has been termed revolutionary in the leading neurology journal in the world. The goal of the diagnostic facility that Bill Gates and a lot of other prominent philanthropists is to develop blood tests, eye tests, digital tests that are going to be inexpensive, rigorous, and accurate for early detection of Alzheimer's disease in clinical practice. Alzheimer's is already the most expensive disease in the United States. The number of people with Alzheimer's disease is going to triple in the next 2 or 3 years. If we could delay the onset of Alzheimer's by just 5 years, we would reduce the number of people with Alzheimer's dementia by 50%.
I'm a supporter of the ADDF because they will find a cure for this disease.
I'm optimistic. Okay, I've been at this 40 years. We've had cancer and diabetes and hypertension research for almost 100 years. We've had research on Alzheimer's going on for about 35 years. On the positive side, we've made incredible strides.
Someday when we have a treatment for works, I guarantee you, they will look at the early stages of that project and we'll see that it breaks it.
Again?
Again. I think Dr. Phillips' hope is palpable, and I hope after seeing that film, and I think it, to me, is one of the clearest and most powerful films I've seen about the mission of ADDF, and I hope it gives you hope. Does it? All those great minds? So this is an extremely important time in Alzheimer's research, and it is encouraging, obviously, to know there are so many efforts underway to find better ways to treat this disease, delay its onset, and prevent it from developing. And we're going to switch gears now, and it is my great pleasure to introduce you to the ADDF's co-founder and co-chairman, Ronald Lauder, who will present this year's Charles Evans Award.
Before I speak on Alzheimer's, I want to say 2 things. One, those of you who remember last year's lunch that wasn't, this year's lunch is much better. There was only one problem. We expected 400 people. We have 426. The 26 people who did not get lunch will get a free consultation with Howard Phillett. So please, let Howard know that you didn't get lunch. Thank you, Paula, for always being such a terrific host. We are so grateful to you all the time. And what you do for ADDF is just so special. I'm just so sorry that for personal reasons that brought you here, that you are not alone in this room. I also want to tell you that my brother Leonard wishes he could be here. As you know, he had back surgery and he has to heal. I wanted him brought in, but he didn't want to do it. But he promised me he'll be there for the next luncheon. Now, on behalf of the Alzheimer Drug Discovery Foundation, it's my great pleasure to present the Charles Evans Award to a longtime loyal supporter and member of the ADDF Board of Overseers, Pamela J. Neumann. tell you a few things about Pamela. She joined the ADF Board of Overseers in 2013 and has become one of the most dedicated individuals in the fight to conquer Alzheimer's. We are thrilled to celebrate Pamela for her tireless efforts on behalf of our mission. Alice and Bonnie created this award to honor philanthropists who make a significant contribution to Alzheimer's research. And Pamela embodies the essence of that award. Because of philanthropists like Pamela, the ADF has been able to give more than $130 million to fund over 600 programs. And these are all for Alzheimer's and related dementias in academic centers and biotechnology companies in 19 countries. Let me be perfectly frank with everyone in this room. The only way we're going to conquer this disease is twofold: brilliant scientists and dollars, or yen, or anything else. That's the only way this will be accomplished. We have scientists working on it. Now it's up to all of us here today to back them up. And that's why we honor Pamela. Like Charles Evans, Pamela enjoyed a very successful professional life. Over the past 13 years, she has become one of the most successful executives in the insurance business. She founded PJN Strategies. She is in the top of her field, starting out at Marsh and McLennan before moving on to Aon. But it's her endless strategy and skillful communications that motivate people. Few people can light up a room like Pamela. She is perfect for ADF because she connects people around the cause. With her infectious energy, like Charles, like Paula, like so many of us, Pamela knows firsthand the hopelessness one feels as a caregiver for a loved one suffering from this devastating disease. Pamela's passion and commitment to Alzheimer's research is directly connected with the tremendous love she had for her late husband, Henry Hank Cates, who passed away a few years ago following his long struggle with this disease. Following the example of Charles, she has continued to keep Alzheimer's research and awareness front and center so that in our time there will be effective drugs for prevention and treatment of Alzheimer's. We are so grateful to have her as part of our organizations. A big thank you to Pamela for all you do. Keep hope on the horizon for all of us in this room and the millions of people around the world impacted by this disease. I'd like to invite Alice and Bonnie on the stage. Alice, Bonnie, come here. On behalf of Alice and Bonnie and my brother Leonard, it's my honor to present the Charles Evans Award to Pamela J. Neumann. Pamela. Here's your award.
My sincere appreciation to Alice Scher and Bonnie Pfeiffer Evans for creating the Charles Evans Award on behalf of Alice's brother and Bonnie's husband, Charles Evans. I am honored to be this year's recipient of this important award. Thank you, Jerry Brown. Thank you, Diane Finnerty. And thank you, Stan Golansky, for your tremendous help in bringing everybody here today. Thank you, Leonard and Ronald Lauder, for not accepting the premise that aging and mind deterioration are inevitable. Thank you, Howard Phillott. Thank you for being Hank's doctor, which inevitably meant you were my doctor. We fought often as you guided me on what seemed impossible, letting go. Howard, I support your vision and your inexhaustible effort to find drugs to cure or allay Alzheimer's. Since the cost of Alzheimer's disease today for the United States alone, exclusive of caregiving costs, is estimated to be $280 billion, this effort is a must priority. Hope. Thank you to everyone sitting here today. Those of you who know me here today know that I frequently rearrange people on airplanes. So would you mind taking a moment to stand up and shake hands with other people at your table to congratulate yourselves on raising over $1 million for 100% application to medical research for the Alzheimer's Drug Discovery Foundation? Please do stand up for a moment and shake hands. Hope. Like many of you, here today, the war on Alzheimer's is a war I have fought in. The war on Alzheimer's disease meant to me, one, watching an otherwise fine person, my husband, plow into a garden hedge while driving 5 miles per hour. Two, coming home from work to find the RN caregiver and my husband in each other's arms. Three, losing my husband while shopping with him. Losing my husband while at dinner parties. Losing my husband while taking a walk with him on Times Square and in Nantucket. 4, having my husband, a CEO of a life insurance company, a real estate developer, an art collector, and an underwriter of Phantom of the Opera and Les Miserables, be both ill enough to have to attend an adult daycare center and well enough to beg me not to send him there. 5, learning from a friend that I looked forlorn, weakened, sad, and exhausted, and probably in need of help from a psychiatrist. Well, I had never been to a psychiatrist. I did go to see Larry's psychiatrist. Well, I saw this psychiatrist only once. The experience was indeed remarkably helpful. I was initially skeptical about this psychiatrist when we met because he kept saying to me, "What? What?" Until I realized he was probably quite deaf. He also didn't seem to get the conundrum I'd expressed to him, that I both wanted this man I desperately loved to live and not to live. That I resented the expense of the psychiatrist's bill. Until he stood up and shouted at me, "Pamela, your husband is dead." Had he not heard me? Did he not understand the predicament of Hank being here, but not being here? Suddenly, I got it. I understood the psychiatrist's point. Hank, as I knew him, had already died. Oddly, when Hank was on his deathbed, he became, I thought, remarkably coherent. I asked him in those last few moments what I had always asked him: who loves you more than life itself? In his classic cryptic humor, Hank responded, "Chairman Mao, our dog." Thank you, everyone here. On behalf of your mom, your dad, your grandparent, your sister, your brother, your in-law, and yourself, thank you for recognizing we are fighting a disease that will affect 1 out of 2 people in their 80s. Thank you for fighting a disease that people fear more than their fear of public speaking and more than their fear of flying in airplanes. Thank you for fighting a war that has made those of us in this room candidates for post-traumatic stress disorder. Thank you for fighting the war against Alzheimer's disease. Hope.
Pamela, thank you very much for your raw and moving account of what has it been like for you to watch your husband slip away from Alzheimer's. And who in this room would have ever thought you were afraid of speaking in public? Wow, bravo on a job well done. On behalf of the entire board of the Alzheimer's Drug Discovery Foundation, I'd like to thank you all for supporting our foundation. And before you leave, don't forget to check and see if you won a door prize. The winners will be posted just outside this room, and the lucky winners can pick up their prizes today. Again, from the bottom of all of our hearts on the board, thank you for being here today. And because of you, we have raised more than $1.2 million this afternoon. We are closing in on a cure thanks to you. Have a great rest of the afternoon. Again, thanks for joining us.